get started. Well, thank you all for being here to our first installment of our Lunchtime Learning webinar series. Today, we are going to talk about 9 tools for building resilient kids. We are the Substance Use Prevention Team. The DPS Substance Use Prevention Program was founded in 2015 as a response to the legalization of marijuana. When our program first started, there were 3 employees and we had staff in 4 schools. We have since grown to, our program has staff in actually 15 middle and high schools. That number has not been updated. And then we currently have additional programming in 17 schools within the district through our training team. Last year, during the 2019-2020 school year, we reached over 12,500 kids with our prevention programming, which is really exciting. My name is Leah Rafa. I help coordinate the training grant. I've been with the district for 5 years. I'll let my colleagues introduce themselves.
And I'm Haley Figueroa, and I am a school social worker as well as a trainer within our team. And I've been working for Denver Public Schools for a long time. So thank you for coming.
And I'm Julie Goldberg, and I'm a trainer for the Substance Use Prevention Team and also a licensed addiction counselor and a therapist. So we really wanted to frame this presentation or this training as looking at risk and protective factors, or what makes kids more resilient. And one thing that we're going to focus on to start is the risk factors. And the CDC and many other organizations have come up with a list of some factors that may make substance use or an addiction more likely, and some protective factors that stop that addiction from occurring. So this list is just, I like to think of it as like things to look out for. They're not like 911 emergency red flags. They're just things that to pay attention to, and to know that someone might need some extra support and some extra social emotional skills to prevent an addiction or risky behavior from occurring. So it's divided into 5 areas: the individual, the family, community, school, and peers. And if you have a student or your child has a history of trauma, you might have a family history of substance use. There might be easy access to substances. You're noticing academic problems in school. And then an association with peers that are also using these. This is just information that there might be a risk of long-term substance use addiction. And ideally, you want to intervene before an addiction occurs with some of these protective factors or tips that we're going to go over today.
Yeah, and so here is a list of protective factors. So just as Julie mentioned, there are things that will put your child at risk for harmful outcomes. We know there are things that are going to protect or buffer your child or our children from risk. So again, here along those 5 domains, individual, a couple here are having strong family bonds, positive self-regard or self-esteem, being engaged in their learning, having a spiritual belief system can all be really helpful individual protective factors. We know there's a set of family factors too around communication, rules, and supervision. Friends, we know we really want to watch who our children are surrounding themselves by. So we want them to be near friends who don't use alcohol and drugs. And we know that friendships that last for a long time will buffer kids against risk as well. And then just as there are individual, family, and peers, we have school and community. So obviously extracurricular activities, we know when kids engage in positive activities, that's really helpful. And then obviously living in communities where there's strong bonds and where kids feel connected are really helpful as well. So we on our team are trainers for a program called Sources of Strength. This program's in about 15 of our DPS secondary schools. And they are all about growing your strengths or growing your protective factors as a way to support mental health. So they've sort of lumped all of sort of that last slide of what I've just said into 8 different protective factors. As you can see, they have it what they call their strengths wheel. And one thing to note is that they really focus on growth and how we can grow in these different areas. So family support, positive friends, mentors, healthy activities, generosity, spirituality, and then physical and mental health. And so just because kids may not have all of these in place, that's really not the goal. The goal is to think about and help kids to grow within these protective factors.
So let's move on into our 9 tips for building resilient kids using the framework of risk and protective factors. So the first tool that we want to provide is teaching your kids self-regulation. And self-regulation, or ways to calm down, soothe the nervous system, is a skill that will last throughout the lifetime. And it's not just something that kids need, it's something that everyone needs. And as kids start to develop, their brain develops from the back to the front. So a really quick, brief overview. This is the limbic system back here. Then there's coordination, emotions, and eventually the prefrontal cortex in the front develops. And the prefrontal cortex is that part of your brain that thinks about long-term decision making, right and wrong, critical thinking. And this part of your brain actually stops developing around 25 to 32, now they're saying. So this part is what stops adults from making really impulsive decisions or stops people from taking really risky behavior choices. And this part isn't fully developed in a lot of adolescents. And so when people are saying like adolescents are really impulsive or they make stupid decisions, part of that is true because of brain development. And we just want to normalize that this prefrontal cortex or the brain isn't fully developed yet in adolescence. And kids need some extra tools to calm down and self-regulate. So just like everyone at some point will feel upset or have big emotions, we want to help kids recognize when they're in that space and then what they can do to self-soothe so they don't turn to drugs and alcohol. Because this experience of having big emotions and needing to calm down will happen throughout someone's life. So the earlier we teach kids these calming techniques, the less likely they are to turn to substances. So this really handy model on the screen is called the hand-brain model, and it was developed by Dr. Dan Siegel, who does a lot with adolescent brain development. And I'll just go through it really quickly. So if you look at your forearm, this is thought of as the brainstem. Then your thumb, your limbic system's down here. Turn your thumb in. This is where the cerebellum is. This is where big feelings are stored. And then these 4 fingers can be thought of as the prefrontal cortex. So when they come over the cerebellum, the big feelings, they help people calm down and recognize what to do to self-soothe. So these big feelings will happen no matter what. And the prefrontal cortex being online, having a calm mind, is what helps adolescents recognize what to do. So when they're having big emotions, which are totally normal throughout adolescence, and reacting in a way where we're like, what is going on? Why are you overreacting like this? Most likely that their lid is flipped and their prefrontal cortex isn't online. So we want to normalize that experience and then help adolescents come back into that calm state. And ways to do it are just naming it, naming that their lid might be flipped and they need to calm down, taking a break, using movement, deep breaths, drawing. There's tons of techniques, and it's not like intensive therapy that's needed or anything like that. It's more so just taking a moment, recognizing that the lid is flipped and helping people come back online. And just like this experience of flipping your lid will happen throughout someone's life and is totally normal, ups and downs of adolescence are also normal. It actually increases emotional intelligence. It helps people with decision making. It kind of brings that prefrontal cortex online, learning how to deal with those ups and downs. So, one way that we like to think about prepping for those ups and downs is through a self care check in. And Sources of Strength did a great job developing a comprehensive plan for self care. And we recommend that adolescents complete this self care check in before an issue occurs because we know that there will be ups and downs. That is completely normal, but it's hard to access those positive resources when you're not in that calm state or your lid is flipped. So this self-care check-in would be great to do with students and kids at home. And it goes through those protective factors that Haley went over in the beginning. So there's a list of positive friends to talk to, mentors to support, activities that make you feel good. There's ways to access generosity, ways to practice gratitude, and good things to keep in mind. So we want someone to fill this out before they're in that place where they're not able to access all these protective factors. And then they know that they have this really comprehensive list of things that can boost their mood when those ups and downs do occur. And this last item is just little tips of things that you can practice that provide self-care to you. And then our third tip is building a team. So to help an adolescent with substance use and abuse, you don't have to do it alone. So much happens when a kid has multiple adults, or so many benefits occur when a kid has multiple adults and resources to go to. So according to the Healthy Kids Colorado survey, youth who think their parents think underage use is wrong are 72% less likely to use cannabis. That's a huge amount. Youth who have an adult to go to for help with a problem are 30% less likely to use cannabis. And then youth who think their teachers notice they are doing a good job are 28% less likely to use cannabis. So just building up that team of adult mentors, whether it's a teacher, a coach, an aunt, a family friend, really decreases substance use in the long run.
All right. So our fourth tip is to support your children's interest. So you'll notice some of these tips don't actually address substance use at all. And it just kind of goes back to those protective factors that Haley and Julian were talking about at the beginning. So trying to support your child, find something that they're passionate about, find something that they love, which can be a challenge. I know some of us adults are still trying to figure that out. But some tips to make that happen is, first of all, do not attempt to guide your kids towards a specific area of interest in an attempt to make them stand out or excel. One thing I think a lot of parents can do, I myself am sometimes guilty of this, is envisioning your child having the same interests as you. So just because you were a star football player in high school, that might not be your kid's thing. It might be, but it might not be. So instead of pushing them towards one specific area of interest, allow your child plenty of time to explore without putting those pressure or limits on them. But do be available to them in order to offer them support and encouragement. As your child is exploring, they may test out the waters with a couple different activities. Some may last long-term, some may not. So definitely start out with some low-cost, low-commitment options, such as renting a musical instrument, buying equipment used, or borrowing. Also, as your child is exploring these, find opportunities to expose them to different experiences and activities to see what resonates with them. You can look at your child's school, see what's they offer, what clubs and sports and activities they offer. Maybe the local rec center. DeferRap.org has a ton of different suggestions as well. And then also stay involved with them throughout the course. And then last, set a good example by having your own hobbies. Go out and do things that make you happy. So Take that yoga class when it's safe to do so. Go running, join a book club. Just do something and show them that it makes you really happy to have these outside interests. So the next tip is have fun together. Get together with your family and laugh. Enjoy your company. Some ideas for that are having dinner together. That's a huge protective factor. It gives your family a chance to check in with each other, talk about your day, talk about what's going well. You could even take a day of the week where you bake or cook dinner together. Host a family game night or a movie night. Let everybody take a week where you get to choose what game or movie to watch. Also explore Colorado. We live in a great state. There's a ton of stuff to do. Maybe one day a month, go out and do something that you all have never done before. Explore a new attraction. And then also meet your child where they are. So find out what it is that your child likes to do and do that with them. If your kid's really into video games, play video games with them, just with the simple goal of enjoying each other's company. And then the sixth tip is keep the conversation open. So when we're talking about substance use and other risky behaviors, it's important to have conversations with your child about your expectations around substances and other risky behaviors. But it's really important to have that as an ongoing conversation. It shouldn't be just one conversation. Okay, I talked to them, I'm done, I'm good to go, they're good, they're protective. It should be a conversation that you have early and often. The earlier in your child's life that you have these risky conversations, the easier they are and the more natural they seem. You can also take advantage of teachable moments. So if you're watching a movie with your child and the main character is drinking, talk to them about that, what they think their actions are like. If a celebrity that your child really looks up to is in recovery, talk to them about that. Or if a friend or a peer is using, that's another great, or is caught using, it's a great example of a time to talk to your child about their use, what your expectations are, and all of that. Also set those boundaries early on. When you talk about your expectations, let them know what you expect, and then also set consequences for what will happen if they do use. It's important to have those consequences in place early on. And then as you have these conversations, sometimes tough questions will come up. So when they do, for example, if your child asks if you've ever used, be honest. Your kid knows if you're lying. Your kid knows you. But also keep it simple. You don't need to divulge every detail about your life, nor should you. Some things should be kept private. But also ask questions. Ask questions about why their questions are coming up in the first place, and while also letting them know that you appreciate them asking them.
Yeah, our seventh tip is to stick to the facts. So we are going to give you some resources about where to find information to have these ongoing conversations with your child. Many of us grew up with DARE, and that was sort of the big assembly or the big lecture that told us not to use drugs. So we know that through lots of research and findings that is not a best practice. We don't do it in schools anymore. And we really want to focus with kids on, building their skills, whether that's refusal skills or coping skills, critical thinking skills, decision-making. That's going to be a better place to help support our kids. So our approach as parents really matters when we want to prevent substance use. We know from research that adolescents are less likely to drink heavily if they live in a home where parents do have rules and expectations against drinking. We also know that we are modeling for our kids. They are growing up in our homes and watching our behavior. So we want to model drinking responsibly ourselves as well in front of our children. We know that permissive attitudes towards adolescent drinking combined with poor communication really is sort of a mixture for your child or teens to have unhealthy relationships with alcohol. Parents who host lose the most. This is a campaign that is from Prevention Alliance. really with the goal of educating parents that, we really want to understand that it's unsafe, unhealthy, and in many communities illegal to provide alcohol for underage youth. So we want to be understanding our responsibilities as adults when it comes to minors drinking. So where do you go to get good information? So we've highlighted a few here. One great resource is Rise Above Colorado. And this is a really fun resource actually to share with your child as well. They have some great information for teens, actually a website that was developed by Teens for Teens. It's called I Rise Above. Which will give your teens, factual information, and is a place that you can go together with your child when you don't have information or answers to their questions. Smart Colorado is with the goal of informing Coloradans about the risks of marijuana use for youth. It's an advocacy effort that, we can all agree that marijuana is not for youth, and so talks about some ways to talk with your child about the risks of marijuana. And then lastly, Children's Hospital always has great resources. This particular link, which we'll make sure we give you guys all of these links, talks about vaping and the risks of vaping and how to talk to your child about vaping. So knowing what to look out for. So as parents, obviously, we're wanting to stay in tune with our children and just monitor any behavioral, physical, or psychological changes that you may be seeing. Some specific things to look out for that are sort of red flags on the next slide are any change in appearance, maybe their habits or actions, behavioral issues that they might be cropping up. They might be having some health issues, coughing, different things related to smoking. And then obviously, if you're seeing any disappearance of prescription pills, money, valuables, those are all things that parents have noticed when their kids begin using drugs or alcohol. So it is so hard, I think, at times to ask for help for ourselves and then also for our children as well. So we need to know when to get outside support. So when your child is faced with these difficult issues. So a couple of things to remember are to ask your healthcare provider. So just always starting with your pediatrician. They have great skills in talking to kids. And they can talk with your kids about the risks of substances and can help you assess if they are having a problem. You might want to suggest your child talk to other trusted adults in their lives. So family members, coaches can be really supportive, counselors, and you can really use these folks to help you reinforce your message as a parent and your goals for your child. And then lastly, every DPS school has a mental health team that is comprised of a social worker and a psychologist. And in a lot of our secondary schools, there's also counselors, which are assigned to different grade levels. And our team has people in about 15 schools. And then our Teen Intervene program is in close to 30 schools. So that's when you have a trained professional that specifically deals with substance use. And we use a program called Teen Intervene, and we train on this within DPS, specifically to screen teens for drug and alcohol issues, and then provide a brief intervention as well. So what are some community resources that you want to get in the hands of your child? So if you have a child who is using substances and you feel needs intervention, the top two resources are places that our team often refers people to. So the STEP program at Denver Health is for adolescent substance use. Synergy is related to UC Health, and it's an outpatient residential and substance abuse program. Both of those take Medicaid. Safe to Tell Colorado, it's great if you can make sure that your child has this phone number, and their schools present this to them every year as well. But this is a place where kids can anonymously report concerns they have about themselves or about their friends 24 hours a day. And then for our LGBTQ youth, there is great programming and resources available at Rainbow Alley, which is a center on Colfax. Second Wind Fund has counseling and treatment for youth at risk of suicide. And then the crisis line, we want to make sure that kids know about as well. There's a text to talk where there's 24 hours a day will be a trained mental health professional that can talk with children who are struggling.
And then we also wanted to provide some online resources. These are some organizations that were already developed and established before COVID, but have really stepped up to the plate to provide wellness and mental health resources for youth and families online. So the first one is Asset. They created that handy model that we used of the brain in one of the earlier slides. But they have a comprehensive mindfulness-based curriculum for middle and high school students, and some schools and DPS are using it, but they've also created this really great at-home toolkit guide for staff and parents to use with youth. And there's 7 tips for mindfulness. So different tips and also different practices that you can do at home with your kids. The next is Sources of Strength. That's that organization that developed the wheel that you see there. They have amazing resources free to the community, tons of virtual games that you can play with students and your kids. They have a wellness plan, they have journaling prompts, they have games to play as a family, and they even have like bingo, which they're calling Quingo. But lots and lots of resources that are really great for building up those protective factors and targeted for at home. And then finally, we have Denver Wrap, which has one of the most comprehensive lists of community resources that I've ever seen throughout Colorado and Denver: mental health, after school programs, substance use programming. And then they also have a monthly calendar that's updated with free events throughout the Denver community for families to do together. They also have lots of cool blog posts with tips and prevention tools.
Well, thank you all for being a part of our first inaugural webinar. So we as a team are wanting to host these every month as a way to kind of bring parents and educators, professionals together to kind of talk about the needs of kids. So upcoming, we are featuring next month Dr. Laura Anthony from the Children's Hospital, who will focus on helping us learn how to combat the impacts of screen time. We know kids are spending lots of time on screens right now. So excited to hear what tips and tools she'll bring to us on November 18th. And then in December, you will hear a lot more about the brain from Dr. Christian Thurstone, who heads up Denver Health STEP program. So talking about what parents need to know. He is an expert in substance use prevention, as well as, really understanding. He's a psychiatrist that really will understand in depth the functions of the adolescent brain.
Wonderful. Thank you all so much for being here. We will share out this PowerPoint and all of the resources that we shared. But we'd love to take some time to answer any questions you have. Feel free to unmute yourself or type your questions in the chat box.
Anything? Well, we'll share out the resources, and you'll have our contact information. So if there's anything you're needing help navigating or accessing, we are more than happy to help out.
Thank you all so much for coming. Oh, we have a question.
Oh, great.
No, it's just Haley.
No, it's Haley. Thank you all for attending. Hope you enjoy the rest of your day and had an okay lunch break with us.